Hello, I'm Val J. Halamandaris, and I have the honor to be the president of the National Association for Home Care and Hospice. I'm here to talk to you about progress in Washington. Yes, there is progress. That progress is in the form of tax revenues. We have far more revenues coming in than we expected. This is very good news. It's also evidence that the economy is starting to turn over. It's starting to boom. Very good news. It also has given us a dividend of time. We have more time with which to work out this issue that's been gnawing away at us about what to do about America's budget. What are we going to do about our budget deficit? Now, we expected to reach the end of our limitation, our debt ceiling, $16.4 trillion. We expected to reach that ceiling in March. The extra revenue that we've had come in has delayed that day of reckoning. Now it's been pushed out to October 1st or maybe even the end of October. So Congress is going to be wrestling with whether to raise the debt ceiling or not during that time frame from October 1 through, let's say, November 15th. And this coincides with the NAHC annual meeting, which will be here in Washington. That's why it's crucially important that everybody get on a plane and fly to D.C. to be part of that annual meeting. So the question is, what are they going to do? Are they going to allow the sequester to continue, which, as you know, shaves dollars off of Medicare for each and every one of us, all provider groups? Beneficiaries, though, are not touched by it. Beneficiaries, and there are no copays that are put in effect for them, and Medicaid has been also spared. Now the question is, are they going to have some kind of grand bargain, some bigger deal that's going to take the place of what's there? Most people think no. Most people think that politicians will not be able to agree. But you can always be surprised. What the president, though, is doing to set the stage is telling Congress that he will use the veto pen if they try to put even deeper cuts on the backs of the elderly and disabled persons without putting in more tax revenues, that he will veto those pieces of legislation. So the whole game is still the same. Republicans want to protect their base. They don't want to see any additional taxes, most especially wealthy people, those the top 1%. They want to protect from additional taxes. And the Democrats, on the other hand, want to protect the social programs that affect their base, their constituents, which is the middle class. And that means protecting Medicare, Medicaid, Social Security. So therein is the battle. It's the same battle we've seen over and over again. You have men and women of goodwill who have basically different opinions, different views of the world. And so this is going to be resolved by sort of foot traffic, people marching on the Hill. That's why I want to give you this idea about getting on a plane, coming to Washington, being part of the March on Washington. A couple of dates to keep in mind. The first one is October 28th and through November 2nd. That's our annual meeting. That's the time frame. Halloween is the kickoff of it. And then again in July 28th through 30th, where we have our Financial Managers Forum. In the end, this is going to be resolved by what you and I do. It's going to be resolved by the extent to which we take matters in our own hands and persuade the Congress that Medicare has been cut enough and cannot be cut a single penny more. We need to get that message across, and that copays would ruin the existing Medicare home care benefit, turn it into something that would not work for the elderly. We're not going to let that happen. So we appreciate your help or your assistance. The president and his veto pen may be helpful to us, but we're not going to count on that. That's what it looks like right now, is that measures will be passed that we won't like, and the president will veto them and send it back to Congress and say, you guys come up with something, a compromise that I can sign into law. The chances of that compromise being developed, I think, are pretty long. So this is a battle of attrition. It's in the trenches, like World War I, inch after inch after inch, and then suddenly there's a breakthrough. We need to be part of that breakthrough. It needs to be a breakthrough on behalf of the elderly and disabled and dying Americans. Come and help make that happen. Thank you.